Hi, my name is Jennifer Kranjak. I am an online hypnosis practitioner helping people in the surgical, medical, and healthcare communities live happier, healthier lives. Did you know that women who work in the healthcare profession have a higher suicide rate than the average woman? This is because of the amount of stress and strain and trauma that they see on a daily basis. They have long work hours and they have families at home that they want to look after. Now, being treated like a servant, being treated like a concierge at a five-star hotel. If you were a nurse working in the hospital sector, you might be dealing with people who are taking their frustrations and their stresses out on you because you are a woman and they think that they can speak to you like this. This is a very common thing. Plus, you're also seeing the trauma and the suffering that people are going through. And it's hard to watch somebody who maybe is terminally ill or they are lying in a hospital bed in a lot of pain, and you are there caring for them, whether you are a doctor, whether you are a surgeon, a nurse, you're working palliative care or in a care home, anything like that. It can be very hard on you day in and day out, seeing this kind of thing over and over again. It can actually create a lot of trauma and serious mental health problems because of what you're experiencing day to day, plus those extremely long hours of high stress. It plays havoc when you are going home. Your home life is going to be suffering in a lot of cases because you're not there all the time. You're missing out on important events. If you have children or you have family, you might be missing those holidays or the school plays or just family vacation time where you want to go and do a day trip somewhere with your loved ones and it's hard for you to get away. Maybe your romantic relationships are suffering because you're not there for your partner when they need you to be because you are on call and you're dealing with so much strain in your day-to-day life. At work, you come home, you just don't have anything else to give anybody else. Even if you love them dearly, it's hard to give more of yourself when you are already empty from giving all day. And it can really wreak a lot of havoc. Even if you're single, you have nobody to come home to, maybe because you can't even find the time to date and meet people because you want somebody there when you come home. So you don't feel like you have to do the grocery shopping and get the laundry done and do all of the chores and all of the things that maybe a partner would be there to help you with. And that is added stress on top of it all. So this is where the depression starts sneaking in and the mental health starts to decline. You start having issues with your self-worth. You start feeling bad. Maybe you're crying alone. You're having these breakdowns, even maybe sneaking to the bathroom at work and the off chance you have a moment to just breathe and try to recover before you step back out in an emergency situation or just a very sad environment where you're dealing with this kind of pain that people are going through or abuse that you might be taking from a patient or from their families or multiple patients and multiple families. It can really take its toll. And this depression, again, it can lead to anxiety, stress, insomnia. The self-doubt will set in. And if you think it's bad now and it's not being looked after and you're not able to deal with this, down the road, it's going to get worse because it doesn't go away. It trauma stacks, as I call it. It just keeps building and building and building until there's a point where you feel there's no other solution. And then you have these ideas of not wanting to be here anymore and even taking thoughtless risks with your own life because you don't care anymore. You're too tired to even think straight or be rational. And when this starts to happen, this is critical because you don't want to get to this point. You know, you have people who care about you and you have people who love you, and there are so many services out there that are available to you, even if it's frightening, even if you feel that you'll be judged, even if you feel that your colleagues won't look at you the same way if they know that you're reaching out for help. You might be afraid that your practicing license might be affected, or that people will perceive you as weak or not capable of even looking after yourself. So how can you be capable of looking after other people? And it can be very stressful for women because we try to be all things to all people all the time. And at the end of the day, our glass is empty. We find that all the time. And it just builds. Down the road, again, it's going to get worse. It can cost you the relationships that you have now. It can cost you being close to your children because when you get home, you don't have that emotional energy to want to be with them. You just want to go to bed and lie down and sleep. You might not be putting the effort into the relationships that you should be, that will actually help make them stronger and thrive. And this is where things start to break down. This is what's going to happen if things aren't changed. And of course, your own health. So you could be looking at, problems with your own physical health. This is going to cost you down the road. What happens if you end up in a situation where your health is so bad because of all of the stress and you break down, you have a heart attack, for example, and you just can't work anymore? Then you lose that income, and then that is something that you may not be able to do, or you even have to get to the point where you consider quitting your job. And this is usually a very difficult thing because the people who go into healthcare, no matter what umbrella you're under in the healthcare world, people do this because it's a passion. This is something that they want to do. They probably wanted to do it since they were children even, and they enjoy working with people. They enjoy the caring for people. They enjoy the interaction with people. And the thought of all of the years of training and of working up to this point to build their career and have that pride in who they are. And it's something that is a part of their identity. And to think about having to give it up because they can't handle the job anymore because too much stress has been piled on top of them without the proper coping mechanisms set into place. I run a therapeutic hypnosis practice. This is what I do, and I run it online over Zoom. So it doesn't matter where you are in the world, we can meet online privately where your professional record won't be affected because this is considered a alternative therapy. I am a consulting hypnotist. That's what that means is I work in conjunction with regular therapy so that we can actually build all-round care. Now, I will help people with coping mechanisms, dealing with that stress, dealing with the anxiety, the panic attacks, the breakdowns, the side effects of depression that you might be going through. Maybe you're looking at alcohol or drinking alcohol maybe more than you should. Maybe you're smoking. Maybe you are starting to experiment with drugs because you're looking to numb and cope. My job is to help you so that those cravings will go away, your compulsive behaviors will go away, and will allow your mind to heal these emotional issues on a deep, deep neurological level. Therefore, your automatic responses are going to be natural, and it's not going to let you spike to a point where you are not going to be able to cope. It will come back down again. You will still feel the feelings that you have. You are still going to go through difficult days, except this way, your spiking level is not going to be so high, and the cravings of your side effects or whatever it is that you're going through are not going to come back. It's going to be under control so that you don't get to the point where you relapse into those old behaviors, those old negative thought loops that you're thinking, your mind is running all the time. We can stop that with hypnosis so that you can function. You can find ways to be happy within our session, and we will set up a plan of action that will be natural to you. You don't have to think about it. It's going to come automatically so that you can cope with work, cope with your feelings. You can find ways to be there for your loved ones, to have time for yourself, and ways to recover every single day so that you don't start spiraling out of control in the future. Now, if you are interested in the kind of services that I offer, again, it's very private, it's confidential online. You can be at home on a computer talking to me just like you're watching me right now, and we will do our sessions that way. I offer free, 100% free consultations online over Zoom. So if you would like to talk to me and learn how I can help you more, I'd be very happy to set up a meeting with you. And I also have a website if you are looking for more information about the style of hypnosis that I use, because it's a very effective and very cutting edge version. Not many people do. And I also have many videos online on my website and on YouTube. So if you're looking for more information, you want to see more of what I have to say about the type of work that I'm doing with people in the medical healthcare community, please explore those videos. And I hope I have answered some of the questions that you might be curious about. And I do wish you a wonderful day.